Hello, everybody. It's great to be here one more time today. My name is Gary Fowler. I'm the CEO, President, Founder of GSD Get You Done Venture Studios, a premier AI and quantum venture studio located in the heart of Silicon Valley. I'd like to welcome each of you to GSD Presents Top Global Startups, where we bring together the entrepreneurs, innovators, and industry disruptors shaping the future of business, technology, and society. My episode today focuses on one of the most urgent and consequential challenges facing the global economy, the healthcare workforce crisis. Across the United States and around the world, hospitals and healthcare systems are struggling with staffing shortages, burnout, rising turnover, and shrinking pipeline of skilled talent. At the same time, millions of students aspiring to healthcare professionals face crushing debt, burdens that make entering these critical professions increasingly difficult. But what if employers stop thinking about hiring talent and start investing earlier in building it? My guest today is helping to redefine that relationship. Joining me today is Tess Michaels, founder and CEO of Clasp, a mission-driven, venture-backed company building a new bridge between education and employment. Clasp enables healthcare employees to invest directly in future talent by helping ease student debt burdens and creating long-term alignment between workers and organizations, in many ways similar to an ROTC style commitment model. She founded Clasp during her MBA at Harvard Business School with a student first perspective and a deep understanding of the economic friction inside workforce development. Before Clasp, she built and exited a company while attending Wharton, then went on to healthcare investment banking at Goldman Sachs and private equity at Vista Equity Partners. She's been recognized by Forbes 30 Under 30 and Business Insider for innovative work at the intersection of education, healthcare, and workforce transformation. Today, we're going to explore the future of healthcare labor markets, the economics of talent shortages, the role of debt in shaping career decisions, and how AI, automation, and demographic shifts may fundamentally reshape healthcare employment over the next decade. With that, I'd like to welcome her to the show. Hi, Tess. Can you hear me?
Right. Hi, Gary. How are you?
Good, good, good. You know, it's interesting because I seem to have a lot of people Can you hear me now?
Gary, can you hear me okay?
Yes, I hear you. Can you hear me?
1 second. Right. Let's see.
Hello, hello. Can you hear me, Tess?
Can you hear me here?
Can you hear me? Can you hear me? Okay. Can you hear me, Tess?
Perfectly. Yes.
Yeah, that was
Nothing like a reboot.
No, it's good, good. So
We would just have to mime to each other.
It's interesting because inside of GSD, I have a couple of Harvard MBAs and also Wharton. So you're in good company. Anyhow, so Eva's going down through here, and she's actually started to put some questions together for you, and she started to fire these. Said, Tess, what first made you realize that the healthcare staffing crisis was not simply a hiring problem, but fundamentally a pipeline problem?
Yeah, so I grew up in a family of healthcare clinicians. And so, I spent my childhood in and out of my mom's pediatric office, filing charts, getting to really connect with the nurses and frankly see firsthand that there's nothing more critical to the fabric of healthcare than just having really committed clinical talent there. However, as I got older, I realized that healthcare, more than nearly any industry, just has such a retention problem. I mean, 50% of new grad nurses leave their first job in the first 2 years of employment. And so with that leaky bucket, the problem just needed a different approach than what the tools the current health hospitals were using.
How did your experience at Goldman Sachs and Vista Equity shape the way you think about workforce economics?
So I feel like Goldman and Vista Equity Partners were just amazing launch pads of getting to work in environments where not only is there sharp learning curves, but you get a lot of pattern recognition. Got to see a lot of different companies and understand very quickly, what were the fundamentals that made them really resilient. And so some of the things that, as I apply it to healthcare, I think about is first, we're in a macro environment that is very resistant to a lot of the change that's happening at such a rapid rate right now. We know we need clinical talent, not just this year, next year, 5 years from now, 10 years from now, and so on. So that means the labor is actually, hyper critical to the whole system. But the second piece was saying, okay, when we think about economics, not all compensation is created equally. There are a lot of different ways that you can pay your talent beyond just salary. How do we think about upfront spend, like sign-on bonuses? How do we think about ongoing spend, like benefits or retention bonuses? And what do they signal to the talent you're bringing in? And are there any economic incentives, like tax advantages, based on the tool you use? And that really led us to student loan repayment as a differentiated financial tool to actually solve this problem.
How do we go down through the one thing? So Eva's she's interested in this. She said, with the escalating cost of healthcare, we're getting to a point in the next 3 to 5 years where it's going to be beyond the capability of people to be able to even afford healthcare costs in the United States. How do we go down through? How can this system help us to be able to keep the healthcare costs and insurance costs in line?
When we zoom back out and think about what the real costs are around healthcare, the biggest line item is the people costs. It's the services business. And ultimately, the way it works in healthcare is there are staffing ratios. So by the number of beds you have, how many nurses need to be, what's the patient to staff ratio really look like? Now, beyond the staff ratios, there is who needs to be staffed. And so, for example, my husband is a hand surgeon. And he always tells me, he's like, it's really important that we have the surgeon in place and we have the nurse in place, but also need to have the surge tech in place, the nurse anesthetist in place. And so in a lot of ways, what we're looking at here is how do you create a balance across each and every one of the different pieces that really compounds into what you need to create that healthcare system. And that in and of itself becomes a really important part of the equation.
And how severe is the healthcare talent shortage really? And do you think most people underestimate it or don't understand it?
Great question. So as I zoom back out into the problem itself, just over the next few years, we are short 100,000 clinicians from a supply perspective versus the demand the market needs. I mean, that is not a rounding error. That is a huge number of individuals that we right now don't have the capacity to train. And it's not balanced across the country. If you look at rural markets or specific counties across the US, there are patients who have to travel hours in order to get effective care, which obviously puts a lot of the US at risk. Now, as far as how the problem is seen, I think that most individuals think of it as just a supply challenge in and of itself. So there's just a problem with recruitment. But the other side of the equation is equally important, which is in order for healthcare to work, we need less people leaving the industry. And COVID, frankly, spiked the exodus of individuals who decided not to jump from just one hospital to another, but to completely abandon the ship and say, I'm going to switch. I'm going to stop being a frontline worker in a hospital and go to an Amazon warehouse because it's safer. It pays me the same amount. And, I feel like this is just better for my life, right? And that's really something we're trying to solve.
What are the root causes behind rising turnover among nurses, clinicians, and healthcare professionals today?
So when we think about the trend lines here and what's actually driving it, first and foremost, turnover is a challenge nationally. It doesn't matter what part of the country you're in. It doesn't matter how large your healthcare system is, what subsector you are in. It is really painful. It has actually become a market norm that About 20% of your clinical talent is turning over every single year. And most employers are proud if they are even able to get that down to teens turnover, which I can't even imagine at Clasp if I had that type of turnover every single year hitting our people. So when we think about what drives this, it comes in a few forms. First is the incentive systems are completely out of whack. Right now, the number one tool that hospitals use to recruit talent is sign-on bonuses. Sign-on bonuses get a butt in a seat, but it does not incentivize retention. They've actually done studies that show for every $10,000 you put in a sign-on bonus, you get about $2,800 worth of value. I mean, that's a negative 72% ROI. And by the way, the main protection around sign-on bonuses is a lot of organizations will include clawbacks. They'll say, hey, we'll pay you up front, but we'll chase you down for every dollar if you leave us early. But starting this year, 2026, a number of states have started to ban clawbacks. Started in California, then New York with the trapped at work law, Colorado, Connecticut. And so that movement is really going to shift what was one of the biggest incentives that was not serving the systems. The second challenge is that we need the right ratios between experienced and new grad talent because you need mentors or what they call preceptors in place in order to actually effectively train individuals and give them a good working environment. And third is there needs to be a recognition around just the types of stress that clinicians deal with that is different than other jobs in the US. And how do we support them on the back end to get to the whole human?
So what happens to patient care if workforce shortages continue accelerating?
The reality is, again, it's not just about the number of individuals at the healthcare system, but the composition of those numbers. So making sure that you have full teams staffed by operation needed. And without an appropriately staffed team, patient care gets delayed. And oftentimes that leads to worsening infections, worsening challenges. We actually saw that again during COVID. They did studies that showed a significant number of hospital-related deaths were just due purely to staffing challenges because time kills. And that's just the reality of the situation.
Do you think burnout's the biggest issue, or is the financial burden surrounding healthcare education equally important?
It's a dual-pronged challenge, right? So when we think about burnout, it's about your mental headspace. Where is it being spent? What are you stressed about? And right now, there are serious issues with education financing in America. So as we look at it, there are two things happening at the same time. First is we've had an industry in healthcare where it requires an education in order to do the job. You can't be a respiratory therapist or a physical therapist or a nurse without having gotten that degree. That's different than, for example, myself, right? I got an MBA. Absolutely, has it helped me, as a executive? Sure. But was it a requirement for me to do my job? No. And so in that vein, you as a prereq need to get this education to do the job. That education costs a significant amount. And by the way, those costs have been rising rapidly year over year. So you have all of these students who are deeply indebted, who are graduating knowing that their biggest bill every month is going to be their rent and their student loans. And so taking that load off of them allows them to focus their stress elsewhere. So that in and of itself is its own challenge. Now, compound that with the fact that on July 1st, the federal government is putting in place about $13 billion of federal student loan cuts. And those cuts are directly hitting clinical talent. So roles like physical therapy, occupational therapy, nurse anesthesia, physician's assistants, nurse practitioners, they used to be able to borrow unlimited federal student loans. Now, they can only borrow $20,500 a year. By the way, that includes not just tuition, but housing, books, food, fees. My undergrad cost nearly 4x that per year, ages ago. So now you're taking a problem where people were stressed on the back end and you're adding that stress on the front end saying, who's going to enter healthcare and who's going to be able to get through school? And by the way, if you take on debt and don't even graduate to get the degree, that is the worst case scenario.
Yeah, that's what I
For
would say. That's a
yeah.
problem, right? And what's the percentage of, doctors that start medical school that don't finish? I mean, it's not, there is a percentage, and what happens to them, right?
Yeah, absolutely. So that is one of the biggest challenges in America is looking at individuals who were not able to get that economic lift in their life because they weren't able to start the new job, but we're stuck with obviously a mental lift of having to deal with the debt that they took on.
How much does student debt shape career decisions in healthcare?
Yeah. So first of all, I don't think it's just healthcare alone. I think student debt shapes what careers people go into, period, full stop. Actually, the earliest iterations of Clasp really focused on saying, hey, from a financing perspective, what if the types of student loans individuals were able to get access to tied the outcomes into the equation and said, you'll pay it back as a percentage of what you actually earn. Now, what individuals know about healthcare is it's at least a stable profession. We know that you'll be able to get a job, a good job, and be able to stay in that job as long as you want to stay in that job. But oftentimes, the amount of debt you have to take on is not commensurate to the salary you are earning. So I'll give you an example. In the US, the average debt to income ratio is about, 60% or so, right? So, you end up borrowing $40,000 and you make, high five figures.
Hmm.
However, in certain professions like physical therapy, you borrow $150,000 and you earn right under $100,000 out of school. And so suddenly you've nearly 3x that debt to income ratio. And that means that people have to justify something that's not always economically rational for their heart, the mission, like what they want to do for the world. And that's an unfair place to put people.
What do you think happens psychologically when young healthcare workers begin their careers already financially overwhelmed?
The reality is when individuals start their careers from a place of stress, it makes it that much harder for them to lean in and actually do the purposeful work that they signed up for. You need to be all in on a new job, which means all your energy needs to be spent on like soaking up knowledge, throwing yourself in and dealing with a whole slew of wonky patient cases that take its own level of just like grace and patience, right? And so again, I think that is really how we think about this is flip the order of operations, give individuals peace of mind by bringing employers into the equation earlier when individuals are in school. So they get earlier commitments to jobs and commitments to significant student loan repayment. If you do that, suddenly you now have a system where individuals feel supported from the outset and they're incentivized to stay. And that's the holy grail.
Why do you think traditional tuition reimbursement programs often fail to create long-term retention?
Traditional reimbursement programs have historically struggled for a number of reasons. One, when a healthcare system tries to offer financial support themselves, they typically have to, as you implied in the name, reimburse the individual, which means the individual pays out of pocket and then gets reimbursed later, versus taking on a loan where they're in deferral, so they haven't actually paid any dollars out, and then getting that loan repaid, right? So one is just financially, it's more cumbersome for the individual. Second is the timing of the reimbursement. Oftentimes, the reimbursement happens once you're already employed as a benefit or a total reward, but not from a recruitment perspective, not while you're still in school, which is really important to get people more motivated to get through school and to start their job on the right foot. And lastly, there are other things that we just do at Clasp to help gamify retention or really engage and support that talent. And those pieces can't be, overstated. They're actually really critical components to making the whole system really work together.
So how does Clasp align incentives differently between employers and employees?
Part of what we do from an incentive alignment perspective is a twofold. One, we really try to understand the employer's needs. So it's not a one size fits all. It's not like every single clinical individual who works in your system is going to get $5,000 a year. No, 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 no. What we do is we say by role, by unit, by shift, by facility type. Let's figure out, what are you spending on this talent that's going wasted? What are the dollars you're spending on contract labor? So locums, travelers, all these premium contract costs. What are you spending on those transactional upfront sign-on bonuses? What are you spending on wasted turnover costs? What if we were to repurpose or reallocate that toward student loan repayment? If we're able to do that, then suddenly you are able to totally change the way you engage with talent, because you're signaling something different for what you stand for and what you expect from talent on the back end.
Do you think healthcare organizations could eventually compete on career ecosystems rather than salaries alone?
When you say compete on career ecosystems, where's your head at? I just want to make sure I'm interpreting it.
The situation is, you're coming into a company. It's more like, I look at it kind of like the military, right? When you go into, you're a doctor and you get recruited into the Army, they end up taking care of your debt. Is it going to be more like that kind of a model?
Yeah. I actually recently gave a TEDx talk where I specifically talked about the ROTC model with the military, which is one of my favorite analogies for what we do at Clasp. We zoom back out. What we are doing is the closest proxy. We're helping healthcare employers meet clinical talent while they're students in school. They then lock them into a multi-year work commitment and help repay their student loans as they're retained. And for me, this is very personal. I grew up in Texas. I remember at the ripe age of 15, I was went to what I thought was a typical high school leadership camp, and ended up being a military leadership camp. And so I spent the summer learning from individuals who are going to join the military, who are getting supported, with these commitments to a job once they graduate, and getting a lot, they're getting to be debt free. And it really sparked something, which was like, wow, the incentives are perfectly aligned. And this has been building one of the largest workforces we've seen for generations. And so what if we could just take a page out of that book and apply it for healthcare?
So what generational differences are you seeing between younger healthcare workers and previous generations?
At Clasp, we support a pretty wide range of generations, but as you can imagine, Gen Z is a large part of our population of students. And what we've really seen is just the channels we work through are unique. For example, we partner and have a whole curated network of TikTok influencers, which I know may sound funny, but it's highly effective. And these are not just, traditional influencers. These are clinicians. These are physical therapists or respiratory therapists or nurse anesthetists who have 50 or 100,000 followers with tons of engagement, who are able to share through inspiring or goofy posts the ways that this loan repayment's really going to show that these employers are in their corner. And so again, that's like changing the types of channels that we use, creating ambassador programs, like really trying to, again, make the movement one that resonates with someone who probably doesn't get the same joy or satisfaction from just going to a career office like, many people did back in the day.
So this is so Eva's starting to put some more questions out to you. So she says, could my AI, could autonomous AI systems eventually become part of the healthcare staffing infrastructure?
I absolutely think AI is going to be a critical component in healthcare. It's just nuanced. So the reality is there are so many manual workflows right now in healthcare. And so you see just like a proliferation of tools like AI scribes and other tooling to really reduce those parts of the job. But having the human in the equation is really critical as we think about patient care. And so a lot of that shift will just start to move and migrate how someone spends their time, which I think is really important as we think about augmentation. There are then also some fields which are even further ahead. So for example, my brother-in-law, radiology is a field where we've really seen a lot of push around individuals saying, hey, could we experiment with like how diagnoses are made and how scans are read? And if we could do that really well, it might make for just a more efficient system and potentially more effective scanning, right? And so again, I think it'll be role by role on what the innovations look like for the specialty, but then the aggregate of healthcare will definitely see augmentation on those manual pieces.
Do you think hospitals and healthcare systems are finally starting to think about talent pipelines instead of being reactive?
Absolutely. Healthcare is one of the most predictive or predictable fields as far as thinking about workforce planning. However, there's this contrast of the urgency of the shortages that are happening right now. And so the balance there is to say, hey, how do you get someone to be motivated to think about the problem they're going to have tomorrow and the day after that and the year after that and the 2 years after that, at the same moment that the house feels on fire because they don't have staffing in place today. And that's really where we partner with healthcare employers, give them that balancing act. We're like, it's not an either or. Let's make sure to prioritize and get the clinicians you need in today, because otherwise you can't operate and patients are getting impacted immediately. And let Clasp help you build a further out pipeline so that you can sign what are essentially letters of intent with individuals committing that you're going to get them a job once they graduate, give them that student loan repayment, lock them in so that tomorrow is much less stressful than today was.
So do you think employment itself is evolving from transactional to relational?
Absolutely. So part of our mantra is that employment has to evolve from transactional to relational. And the reason for that is one, the population that we're serving demands it, needs it, craves it. And at the same time, it's really important to think about, why we are in the situation we are in. And part of why we're here is because while healthcare is very mission driven, the urgency around hiring has forced it to become transactional historically. And it's a moment in time for us to shift that thinking.
What is one thing society is underestimating, Tess, most about the healthcare workforce crisis?
When I think about the healthcare workforce crisis, I think that society views it as what we see around us, doctors and nurses. But the reality is, a lot of the biggest pain points are the roles that there may not even be enough national awareness around. It's the allied health roles, it's respiratory therapy and rad techs and surge techs and, physical therapy and nurse anesthetists, et cetera. And those critical roles, well, they are the whole ball game, because without them, again, you can't have the right staffing model in place.
So we're coming up to the top of the show, Tess. If you want to stay on for a few minutes after it's done, one final question and then closing thoughts from you. If healthcare is ultimately built on human trust and compassion, how do we preserve that humanity while scaling the workforce for the future?
One of the most beautiful parts about healthcare is its heartbeat. And part of what gets individuals excited about entering this field, even when the math doesn't always math, is knowing that you are directly impacting the life of a person every single day. And so in a lot of ways, what we're looking for is how to make employers share that same heartbeat back to the talent that they're hiring and make it consistent across their whole system by saying, hey, I see you. I know what stresses you out. I am here to help you with some of your biggest pain points. And that can come in a lot of different forms and fashions. And part of what we're saying is it's a step in the right direction to say, just rethink your strategy. Don't even spend more, just reallocate, because sometimes being compassionate is just knowing that you have to know the individual you're supporting and not sit from your seat as the employer, but sit in their shoes for a moment. So,
No, that's fantastic. And Tess, closing thoughts and how do people get a hold of you?
yeah. First of all, this was so fun doing this together. And look, this is a problem I am like beyond passionate about really cracking, because the reality is each and every one of us has been a patient at one point or another in our lives. And in those moments, what you really want is for the person who's taking care of you to feel cared for too. And so if you are interested in this topic at all, want to spend any time together, please reach out. My email is just Tess, Tess, at Clasp, CLASP.com. Again, it's Tess, Tess, at Clasp, CLASP.com. And it was really fun doing this together, Gary. Thank you.
Yeah, no, thank you very much. And to all of you out there, We're now over 1,700 podcasts and millions of views. Today, GSD's in 73 countries around the world. And our family office and our venture studio are out there scaling companies at a rate that's unprecedented. And thanks to all of you. Thank you, Tess. Thanks to all of you. Stay happy, stay safe, and stay healthy. We'll be back to you again soon. Tess, if you want to stay on for a few minutes after the show, happy to talk. Thank you, everybody. And thank you, Tess.
Thank you. Thank you. Thank you.